My name is Ed Balaban. I'm a chair of the Pennsylvania Medical Society, and today we are bestowing an award for community service to Dr. David Silbert. This award is given every other year, again recognizing someone who has distinguished themselves for community work. So Dave, the program that I understand, it has been ongoing since 2007, is called Kinder C. Kinder C is a program that started actually 2007, 2008 with a seed grant from the federal government. As I understand, it was over $100,000, something like that. But it led to monthly exams. Dr. Silbert's ophthalmologist here in Lancaster. He and his staff once a month now go to an inner city school to give first class free ophthalmologic exams. This leads to treatment, perhaps eyeglasses, and advice from there forth. This is again, a free treatment and exam to those that have applied and are available to get this sort of thing. This is, again, been ongoing for 14, 15 years. So this is a remarkable, and I suspect it's easy to say, a long overdue recognition of the work that you've done for the Inner City School of Lancaster. Dave, I'm sure I've left out issues and things about Kinder C that our community wants to know about.
Yeah, so we started going to the schools. Actually, we started just carrying our own equipment to the schools. And we were going to George Washington Elementary School, which is in the southern part of Lancaster City. And it's a very impoverished area. Basically, I can't remember what percentage of the kids are school lunches, but it could be in the 90% range. And so we started going, and we were bringing our equipment, and then it was actually in 2008, 2009, in the Great Recession, there were some grants available, and we were able to get a federal grant for capital equipment for school-based health centers. And Lancaster General was developing a school-based health center in this school. The school was being renovated, and we got in and we were able to get a lane and a half of equipment dedicated to that school. So since then, we've been going ahead and we've been providing the care. And we do utilize the kids' Medicaid. We are able to see kids below 2 times the poverty level. The kids who don't have Medicaid, the insurers have allowed us to waive their copays because we can't collect money there. So what we do is we provide care at no cost to the kids. And there are kids we also see who have no insurance at all, and we will deal with that as well. So we go once a month and we'll see 40 kids. I'd hope to be able to increase this over time, but it's just very, very challenging from an economic standpoint to make it work. But we see kids, we provide glasses there. If there's surgery that's required, we schedule the surgery and we do the surgery through our office. And so it's an integrated system where the kids are screened in the school district of Lancaster, they get sent to us, and we decide what they need and we get it to them.
It's just an amazing program, and when I heard of it and read about it, it goes without saying that this award needs to be for you and for all the staff here at Conestoga. I should point out that not only is this award winning for the exams that go on, but Dave and his staff have also contributed to the world of academics too. They have a number of peer-reviewed manuscripts that I'm sure have in some way come out of this kind of experience.
Yeah, we've also done mission work in Honduras and Ecuador, and so we've done studies looking at how to screen children for lazy eye and what the best technologies are. So there are certain photo screeners that we use for these things. So from my standpoint, I have an interest in providing care to underserved communities, whether it's here or whether it's abroad in Central or South America. The other thing is we want to see what's the most efficient way to provide the care. What's the best way to identify kids who have amblyopia, which is a poor vision in a normal eye and may need glasses or may need surgery to help them with this. So I've always been interested in that. It's just the provision of care, how you do it most. We get a little wonky here, that I'm kind of into this stuff, but also trying to deal with these communities who really don't have access. There are only about 1,000 pediatric ophthalmologists in the country. And if we did not have Kinder C in the city, it would probably take kids 9 months to get into a major academic center, whether that's in Philadelphia or at Hershey, to see a pediatric ophthalmologist. There just aren't appointments available.
Long overdue. This is just a great honor and privilege to be able to present to you this award for the community voluntary service from PAMED. And let me shake your hand. And thank you very, very much for what you do.
Thank you.